Ever wondered if something as small as a handful of nuts could make a meaningful difference in how you feel, move, and age after 60? Do certain nuts actually help your heart, steady your blood sugar, or even protect your brain despite being high in fat and calories? And what about common worries like weight gain, kidney stones, or too much selenium from Brazil nuts? Are those real risks or myths? In this deep, fact-based guide, we break down what high-quality studies and major health organizations actually say about nuts for men over 60 so you can decide confidently whether this simple daily habit deserves a place on your plate. Across decades of nutrition research, higher nut intake is consistently linked with better heart health. Systematic reviews and umbrella reviews conclude that nuts help improve several cardiovascular risk markers, particularly blood lipids such as total cholesterol, LDL, triglycerides, and apolipoprotein B mechanisms that translate into lower risk for coronary heart disease over time. Importantly, this benefit shows up whether you prefer tree nuts like almonds, walnuts, pistachios, pecans, and hazelnuts, or peanuts, which, although technically a legume, provide very similar nutrition. The evidence is not based on one or two small studies, but on large bodies of work spanning decades, and the consistency is what makes it so reliable. The heart story isn't just about lab results. In the landmark Predament trial, one of the most widely cited dietary studies, adults at high cardiovascular risk who followed a Mediterranean diet enriched with mixed nuts experienced fewer major cardiovascular events compared with those on a low-fat controlled diet. Even after corrections to the trial's randomization methods, the core finding held strong. Adding nuts as part of a Mediterranean dietary pattern supports better cardiovascular outcomes. For men over 60 when cardiovascular disease becomes a leading health concern, that is a simple and food-based intervention with solid evidence behind it. This is especially relevant because after 60, arteries naturally stiffen and risks of hypertension, atherosclerosis, and heart attack rise, so any food habit that improves vascular health is worth serious attention. Nuts provide these benefits because they concentrate unsaturated fats, fiber, plant sterols, arginine, magnesium, potassium, and a wide range of polyphenols. These nutrients work together to improve lipid metabolism, vascular function, inflammation, and oxidative stress. Walnuts are especially notable for containing alpha-linolenic acid, a plant-based omega-3 fatty acid linked to heart health, while almonds are high in vitamin E. Pistachios and hazelnuts contribute lutein and other antioxidants, and pecans add more polyphenols. Each nut offers a slightly different nutrient package, making variety a powerful strategy. Traditional diets across cultures reflect this diversity: Mediterranean diets with walnuts and almonds, Middle Eastern diets with pistachios, South American traditions with peanuts and Brazil nuts, all showing that nuts have long been considered valuable sustaining foods. If you live with prediabetes or type 2 diabetes, a common reality after 60, nuts can also help. Meta-analyses show that including nuts in a balanced diet can improve blood sugar control, with reductions in fasting glucose and HbA1c, when nuts replace refined carbohydrates or are included sensibly in calorie-controlled meals. Observational studies further suggest a lower risk of developing type 2 diabetes among regular nut eaters, although these studies can't prove cause and effect. In everyday life, replacing an afternoon cookie with a small handful of nuts is a simple swap that steadies blood sugar while adding healthy fats, fiber, and minerals. The reason is that nuts slow digestion, release energy more gradually, and reduce spikes in glucose and insulin, making them particularly useful for older adults who want stable energy without big ups and downs. One of the biggest myths is that nuts cause weight gain. This concern is understandable since nuts are calorie-dense. But multiple randomized trials and systematic reviews consistently show that nuts do not cause weight gain when eaten in moderate portions. Some research even shows better weight control among those who eat nuts regularly. This effect is explained by high satiety, incomplete absorption of nut fats, and the fact that nuts tend to replace less healthy snacks. For older men looking to manage their waistline while preserving energy, nuts can actually be an ally, not an enemy. Long-term studies suggest that those who regularly eat nuts may even gain less weight over the years compared with non-nut eaters, highlighting how satiety and nutrient density support sustainable eating. Brain health is another area of interest. While randomized clinical trials have not definitively proven that nuts boost cognitive scores in healthy older adults, there are promising signs. The WAA study, which tested walnut supplementation in older adults, found no major overall improvement, but subgroup analyses and imaging data suggested walnuts may help those at higher risk of cognitive decline. Observational studies also associate walnut intake with better cognitive performance over time. Although nuts are not a cure for memory loss, including them in a diet rich in vegetables, fruits, whole grains, legumes, fish, and olive oil may contribute to healthier brain aging. With dementia and cognitive decline being major concerns for men over 60, even modest support from diet can play a meaningful role in preserving independence and quality of life. How much should you eat? Evidence points to about 1 ounce or 28 to 30 grams per day, which is roughly a small handful. This provides around 160 to 200 calories, depending on the nut, 3 to 6 grams of protein, 2 to 3 grams of fiber, and a balanced profile of unsaturated fats and micronutrients. To avoid overdoing it, pre-portion small containers or follow the handful rule. Choosing unsalted or lightly salted nuts is also important to control sodium intake, particularly for those with high blood pressure. While some studies show benefits even with 2 or more servings daily, a consistent single handful appears enough for most men to reap heart and metabolic benefits without excess calories. Different nuts bring different strengths. Almonds offer vitamin E and magnesium for vascular and nerve health. Walnuts supply omega-3 south for heart and brain function. Pistachios are rich in potassium and lutein. Pecans and hazelnuts add antioxidants, and peanuts deliver protein at an affordable price. Cashews bring copper and zinc for immune support, while Brazil nuts, in moderation, are one of the richest sources of selenium, a mineral important for thyroid and antioxidant functions. Rotating different nuts across the week provides variety and ensures that no single nutrient is consumed in excess. There are many practical ways to add nuts without increasing calorie intake. You can replace processed snacks with mixed nuts, sprinkle chopped nuts over salads instead of croutons, stir nut butter into oatmeal, or pair a few nuts with fruit for a balanced snack. These habits not only add nutrients, but also make it easier to follow the kind of plant-forward eating patterns recommended by the American Heart Association. In addition, nuts can be blended into smoothies, used as a topping for roasted vegetables or incorporated into homemade energy bars. They are portable, non-perishable, and easy to integrate into daily routines. Still, there are a few cautions. Brazil nuts are extremely rich in selenium, and just one nut can provide close to 70 to 90 micrograms. Since the upper safe limit is 400 micrograms per day, eating multiple Brazil nuts daily can push you into excess, which in rare cases may cause selenosis, with symptoms like hair loss, brittle nails, and digestive problems. To stay safe, limit Brazil nuts to 1, occasionally 2, rather than a full handful every day. Another caution is food allergies. For men with known nut allergies, complete avoidance of the specific nut is critical, and allergy testing is recommended if there is uncertainty. Men with a history of kidney stones should also take care. Most nuts are moderately high in oxalates, which can contribute to calcium oxalate stones. This does not mean you must avoid nuts altogether, but moderation, good hydration, and pairing nuts with calcium-rich foods like yogurt can reduce risk. Your healthcare provider can tailor advice based on your individual test results. On the other hand, men without a stone history generally do not need to worry about oxalates at typical nut intake levels. Diverticulosis is another common concern. In the past, doctors advised people with diverticular disease to avoid nuts, seeds, and popcorn, fearing they might trigger inflammation. However, large studies now show no increased risk of diverticulitis from these foods and in some cases even a protective effect. Only during an acute flare is it helpful to limit fiber temporarily. So for most older men, nuts are safe even with a diverticular diagnosis. Flavored nuts, such as honey-roasted or candied varieties, may cancel out health benefits with added sugar and salt. For maximum benefit, stick with plain, lightly roasted or raw nuts. And if you enjoy flavored options, treat them as an occasional indulgence rather than a daily choice. Sodium and added sugars undermine cardiovascular and metabolic benefits, so reading labels is worthwhile. Nuts also play a role in weight management and muscle health, which are especially important for men over 60. They provide plant-based protein, healthy fats, magnesium, and small amounts of leucine that support muscle function. Pairing nuts with protein-rich foods like yogurt can help preserve muscle while enhancing satiety. Even in weight loss diets, studies show that nut-inclusive plans are at least as effective as nut-free ones, and sometimes more sustainable because they are satisfying and enjoyable. For older men, who may struggle with appetite and unintentional weight loss, nuts also offer a compact source of calories and nutrients that can prevent frailty. For cholesterol management, nuts shine again. Studies continue to show that nuts reduce total cholesterol, LDL, and triglycerides without lowering HDL. This effect is strongest when nuts replace refined carbs or saturated fats. Combined with other heart-healthy habits, such as replacing butter with olive oil, eating more legumes, and staying active, nuts provide another layer of cardiovascular protection. Blood sugar control also improves when nuts are used wisely. The best results come when nuts displace refined carbohydrates or are incorporated into mixed meals, slowing digestion and reducing post-meal glucose spikes. If you take diabetes medications, it is worth monitoring your blood sugar when making dietary changes and sharing results with your healthcare provider. In terms of cognitive health, the evidence supports including nuts as part of a Mediterranean-style diet. Even if individual trials have mixed results, the overall dietary pattern with nuts consistently supports better cardiovascular and brain outcomes. In this sense, nuts are not a cure but a valuable piece of a bigger dietary picture. Safety remains important. If you have a nut allergy, avoid the specific nut entirely and consult with your clinician. Keep Brazil nuts limited to 1 or 2 per day. If you are prone to kidney stones, monitor your intake and hydrate well. Choose unsalted options to keep sodium intake healthy. And always keep portions reasonable at about a handful per day. The overall conclusion is clear for most men over 60. A daily handful of nuts is an easy, evidence-supported habit. It aligns with major heart health guidelines, improves cholesterol and blood sugar, supports weight control, and may play a role in preserving brain health as part of a balanced diet. The key is variety, moderation, and awareness of specific cautions. If you want a simple way to start, buy unsalted mixed nuts, portion out 1-ounce servings, and eat them in place of less healthy snacks. Rotate almonds, walnuts, pistachios, hazelnuts, pecans, and peanuts throughout the week. Pair them with fruit or yogurt for extra balance. Try this for a few weeks and notice how your energy, satiety, and health markers respond. Then adjust based on your needs and health goals. Always in consultation with your healthcare provider if you manage conditions like heart disease, diabetes, or kidney issues. In the end, nuts are not magic pills. But for men over 60, they come close to being one of the simplest and most effective food habits for healthy aging. Delicious, versatile, and backed by strong science, they are small packages with surprisingly big benefits. By making nuts part of your daily routine, you are not just eating a snack. You are investing in your heart, your metabolism, your brain, and your future health.